Next, we're going to discuss the items that you would need in order to induce anesthesia. The first thing is the most obvious, the anesthetic machine. The next thing would be ET tubes. You would need 3 different sizes, various sizes. One would be the estimated size that you believe the dog would need, and then one below and one above. And the way you can size for diameter and length is that the tip to the nose and then the opposite tip, the distal part, should not extend past the shoulder. And the diameter, a good reference point would be between the dog's nostrils, how wide it is, and that's usually a good indicator of how large their trachea is and what can fit in there. And then to properly inflate the cuff, fill the cuff with air. And the best way to figure out for proper inflation is to practice when you are not intubating, so that you know what it feels like when it is fully inflated and not overly inflated. And that usually is about it. Oh, no, a little bit more. This is also a good way to make sure it's not leaking beforehand. And you just want the cuff to feel firm, but not to lose air, which this one actually might need to be replaced. But anyway, you get the point. So then you also need a syringe case so that you can inflate the cuff once you've placed the ET tube. The next thing you would need are some gauze squares so that you can hold the tongue out. Whoops. And a laryngoscope so you can see into the dog's trachea to be sure that you're placing properly. An external light source also can be of assistance. Then for the endotracheal tube, you would need a tie to hold it to the dog's face so it doesn't slip in and out of the mouth. Eye lube is very important so that their corneas don't dry out while they're under anesthesia. And then next you would want a table, which I have over here. And this is easily rolled in and out of the surgical room so that you don't have to lift a heavy animal. And then also you can do a towel, which the pet would be laying on, and the one person holds one end and the other person holds the other end and carries the dog safely into the surgical room. And that's it. Thank you.
All right, we are going to place a catheter in Rosa here before her surgery. Start low in case for some reason this catheter is difficult to place. I know, you're okay. It just tickles. Just tickles. Alright, switching out my gloves since I just shaved all that hair. I don't want it sticking. Maybe. Maybe. Bloopers. Oh, there we go. Now I'm just going to clean up all the hair and get her ready to place the catheter.
Aseptic scrub on the insertion site.
So I'm using Chlorhex scrub and solution to clean up. And this first one I'm just going to get all the excess hair off just so it's not hanging out. Oops, and the garbage is way over there. So now I'm going to do a 3 scrub just to make sure the area is nice and clean. No dirt in the area. Thank you. Alright, and this is a 3. And she is clean on the scrub. Now I'm going to use the solution just to try to rinse all that off. If I can get my fingers to work. Alright, now we're going to just dry her up a little bit. That tape will stick. Good girl. That extra hair. Actually, I was caught drying with unsterile gauze, so I'm just going to do one swipe over the vein just to make sure it is nice and sterile before I place the catheter. Just to get all that extra moisture out. Swipe. Good puppy. All the extra moisture off my hand. Okay. I'm just going to feed this until I get a flash. Maybe. Alright, so I've got a flash. Got to do a teeny bit of fish in there. I'm going to leave that in for just a second while I get my flush. Maybe. Come on. Alright, I'm just going to feed a little, make sure it's in. Can you feel it? Alright, so we are in. Grab my tape. I'm going to tape under the catheter. No, I should do the other one first.
Anchor.
I'm going to anchor my catheter. I'm going to go up and under. Get this little guy out of the way for a second. Make sure that stays in there. Make sure I'm still in, because I just had to play with it a little bit. We're good. and under one more time. Ready? Sticking. Need a little more practice with gloves on. I'm going to go ahead and lock this for now just so it stays out of my way. Okay. Like that, and then one more piece of tape. Under this piece and hold that in nice and tight. She's good there and she's ready to be hooked up to her fluids.
You started last year, you had to, we got actually had cancer risk from her sarcoma.
Stay. There, decided on the other side. It's right there.
It totally will roll on you.
Very annoying. Oh, come on. Why do you have to have a roly-poly vein?
It's better than it was, but now it's just all surgery and oh yeah, and every time he's like,
Oh my God. Stay. Felt it, but it's not.
Got a flash.
Is it all the way in?
You can pull back on the
Pull back on the stylet and see if it flows.
crazy back stuff too.
You may get a little bit of a blowing, but it's still flowing, so.
Can you pull that for me, please? Thank you. Not doing your job if you're not making a mess. Okay. We are in. Now I just need to secure the catheter. Slightly bit awkward.
mammography, it's responsive to them.
Verbally not taping myself to the dog.
It looks to be like a black bag.
The tape underneath. Not the prettiest catheter, but as long as it's functioning, it'll be okay. Go ahead and lock that in place. Don't be so jumpy, you're okay. Oh, bless you. Alright, we're all secured. I will end up putting one more piece of tape just to make sure everything stays down. But we've got our catheter.